मैं जी आया मैं प्रेम पे आना पियाया ओए रमता जोगी
Modern cities are a symbol of India's booming economy, and in this particular emerging metropolis, Gurgaon, there is plenty of wealth, opportunities and jobs.
Cyber City, Gurgaon's futuristic business district, is a magnet for young workers.
General Electric was the first international company to set up shop here back in 1997, and since then a whole wave of multinational corporations have followed suit. This is where India has bought into globalisation.
Gurgaon has become one of the world's biggest outlets for foreign companies looking to outsource office work. Genpact provides accounting and admin services to international clients 24 hours a day. 1,000 employees work on each of their 4 floors. Such white-collar factories have created an industry worth $17 billion in export revenue, which has no problems attracting workers.
The story of Indian healthcare is just about a decade old. In the last 10 years, Indian healthcare has seen a complete transformation from a medium-sized nursing home dominated industry to tertiary care, top-end hospitals ranging from the Apollo Group to Fortis to Medantas. Today, India is attracting a large number of international patients to its hospitals, offering cutting-edge technology and the best care and treatment at very, very affordable prices. People from all parts of the world are looking at Indian healthcare industry with great interest. As far as the investors are concerned, most of the private equity venture capitalists are investing hugely in Indian healthcare because the returns have been amazingly good. Companies which invested 150 crores in Medanta in the year 2009 have just exited, multiplying their money by 600% in a short period of 5 years. There's been other success stories, smaller setups like IQ, Vasanai Care, Access Dental. Within a short period of 3 to 4 years, they've multiplied into 20 to 25 centers and have got valuations in excess of 150 crores. Now, where does this take? Where is the Indian healthcare industry headed? To give you a brief about the Indian healthcare industry, today about 15 to 20% of the space is being occupied by the top-end tertiary care hospitals, while the remaining 85% of the Indian healthcare is still in the nursing home segments, which I call the mom and pop shops, because it's the husband and wife dominated. Husband is from one specialty, wife is from the other. So the hospital is primarily offering services in 2 specialties, but as the demand of the patients increase, so they offer this space to other doctors who put up equipments over there and start offering services. One of the biggest problems in Indian healthcare is that when it comes to the top-end hospitals, when it comes to the healthcare brand creation, the best and the top specialist doctors are no stakeholders. The people working at the top-end hospitals have 0 stakes. Now this is where EHL came into the picture. EHL, promoted by one of the most renowned physician that India has produced, Jagmeet S Soin, and a healthcare entrepreneur, Kuldeep Chaudhary, along with some more people. The idea is to make the doctors shareholders, the doctors stakeholders, and with their help to create a brand so that when a doctor retires after doing human service to the society for 30-40 years, the brand just doesn't dissipate. Now, taking this idea further, EHL Healthcare is in the process of creating 10 healthcare brands which will provide services, which will be available for outsourcing the non-existent business in the nursing homes and the hospitals These will be branded across all specialties. So there is Naina, which is the eye center, there is Shindent, Clack, so all segments of the Indian healthcare industry is being taken care of by these brands. The first setup is coming up at Gurgaon across a wonderful facility spread across 30,000 square feet. In the next 10 years, the group plans to expand into 50 major Indian cities with having centers, about 250 centers, and creating a group net worth of about in excess of $1 billion. Now, since the group would be owned by doctors, this will be a great opportunity for them to increase their money multifold through investment in the healthcare industry, where they will actually be able to contribute into the growth of this business. Patients from more and more countries will keep looking at Indian healthcare, because if we can keep introducing more cutting-edge treatments, if we continue to lower the cost of treatments, continue to manage how the treatment is delivered, improve on the medical outcomes, then even the developed countries would like to take advantage of this booming healthcare in India. We are already seeing patients, uninsured patients from many developed countries, including United States of America, coming to the Indian shores getting treatments.
EHL offers you the opportunity to invest your money in the Indian healthcare and see it multiply in leaps and bounds. The money would be invested in creating 10 healthcare brands, which will give the doctors and other people a great opportunity to turn into entrepreneurs. If you look at, as I mentioned earlier, if you look at the investments in the Indian healthcare, they have grown tremendously, backed by huge profitability in the Indian healthcare market, which is based on low cost and higher volumes. There are multiple examples. IQ, Center for Sight, Access Dental, all have multiplied the money 6 to 7 times in the last 5 years period. But the biggest example is Medanta, which commenced its operations in the year 2009, and the company which invested 150 crores exited in a 4 years period, multiplying their money by 6 times. The venture capitalist funds are also very keenly looking at the Indian healthcare market. So Carlyle bought this 24% stake in Medanta for 950 crores. Other PE funds are also investing very heavily. Just in the year 2012, we saw 1.2 billion money pumped into the Indian healthcare industry. Now, the GNH hospitals as a concept of ambulatory daycare surgical centers, the brand would have 10 more brands surrounding it, which will then multiply into multiple centers across all Indian cities. The place of pride is reserved for EHL, which is Executive Health Lounge. Naina is the chain of eye hospitals within the group. Surgent is the first branded surgical ENT surgical center. Shindent is the dental center. LapSurge would offer surgical laparoscopic surgeries of face, while Clacks would be the center for laser and cosmetic surgery, offering all skin and laser treatments. Rehab Train would be the first branded physiotherapy setup. Kilkari is the chain of mother and child centers, and Dhadkan is the preventive cardiology setup. Now, if we scan the newspapers, the stories appearing in the Indian newspapers in the last couple of years, this was a story that appeared on the 3rd of August 2013. On the cover page itself, it's mentioned birthing boutiques attract big business. Huge investments are coming into the Indian healthcare industry from venture capitalist funds. Now, EHL is coming up with its first facility in the year 2014 in the Millennium City of Gurgaon. As you see, Gurgaon is the fastest growing city in the country. This is the face of the healthcare in Gurgaon, where top brands like Medanta, Fortis, Artemis, Max, all these people have entered, because the demographics of Gurgaon offers a great opportunity. There are more than 7,000 expatriates living here. There are more than 10,000 top executives, including CEOs, MDs of MNCs. There are more than 75,000 women execs, and there is no exclusive women healthcare facility. There are more than 500,000 other executives working in the cyber hub. Now EHL will offer this exclusive health checkup facility to all these people. It will specialize in women imaging, which is for which there is a huge demand. The cutting edge equipments, the latest technology, things like gamma camera, latest ultrasound machines, mineral density, mammography, all these equipments will be housed in EHL. There will be a 1.5 Tesla MRI offering the most advanced diagnostics, whole body CT scanner. So it is a very tech heavy but very state of the art facility. The ambience, the internal setup, everything is very hygienic, and this what you're seeing is the patient lounge. Then all the other facilities, dining room for the executives who come for checkups and fasting. Even there would be the facility for get admitted for a day and undergo the entire battery of tests. The environment would be absolutely hygienic. Now this would be a state-of-art modular operation theaters at the facility for carrying out all kinds of surgeries. The laser center would be equipped with all kinds of lasers for beautification. The dental center would offer all dental treatments. The mother and child center would have, this is the picture of an LDR suite, which would just give an out of this world experience to the people who frequent the facility. The eye center would have a facility for cataract surgery, for LASIK laser surgery, and this would be a state-of-art rehab center for all kinds of alternative treatment and physical fitness. Now a brief about EHL. It's a private limited company with Kuldeep, Chaudhary, Purnima Deshwal and renowned physician Dr Jagmeet S Soin as the promoter directors. 20% stake would be reserved for doctors, while another 26% would be available to the investors. We've leased a prime property in one of the best location of Gurgaon. The beautiful building offers us 30,000 square feet of space spread across 4 floors. The basement and the ground floor would have
I proceeded to get myself checked, and at that time I found that my electrocardiogram was totally normal.
How simple or complicated is this test?
This test is extremely simple. It involves doing picture of heart circulation using a radionuclide and using a huge gamma camera with nuclear medicine technologists. We can take pictures of heart circulation in the heart at resting stage.
Right.
Why it is important to compare the heart circulation at resting stage with the circulation at peak exercise, because heart being an organ which needs 100% oxygen, and when you increase the demand on heart to function more, that is by exercise, the heart blood flow must increase by 3 to 5 folds.
Which one of these is a normal picture, or are they all abnormal?
No, this is a normal resting
Okay,
picture.
that's good.
That is good.
Okay,
But at exercise, how abnormal it gets.
okay. And are any of these pictures of hearts after exercise that are normal?
No,
These are all,
No.
these people all have problems.
yeah. No, this is
you.
this is a picture of one
You
patient
have problems.
at rest and at exercise.
Okay. This is why here at the Longevity and Wellness Center of South Texas, over the last 3 years, not one patient has had a heart attack.